Yes, your penis can shrink, and there are lots of causes, including high blood pressure and peripheral vascular disease.
Oh,
see, that would be
smokers.
the atrophy,
Smokers, yeah.
Low testosterone levels and aging may also affect the size of the penis, as can having a significant curve due to Peyronie's disease.
Yes.
Some types of treatment for prostate cancer, such as radical prostatectomy, can affect the size of the penis.
Well, and a lot of those guys will have hormone treatment to block testosterone, and it's called chemical castration, or I mean, that's one term for it. And that could also just reduce the size of any testosterone dependent tissues. So,
Are multiple erections during the night normal?
yes, absolutely.
Okay, that's true.
Now, do you know how we determine if people are having erections at night? We've talked about this a long time ago. One way to do it is to take old school stamps, and you would wrap them around the penis and then lick the last one and attach it. So it's a band around the penis, and then in the middle of the night, if you have an erection, you will break the band. Now, there are manometers or pressure sensors that you can wrap around the penis as well. And we do this for people who have suspected psychological impotence or psychological erectile dysfunction, where you think it may be all just in their head.
Right.
And so if they're having erections normally in the middle of the night, then that lends credence to that hypothesis. If they don't, then it may be physiologic, and you need to do something about it.
And you know what you can? You can also use a little thin piece of Scotch tape.
Sure.
Just gently. If you don't have a bunch of stamps laying around, which a lot of this, a lot of kids right now don't even know where to put a stamp on this envelope, which is insane. But
that's true.
But you don't want to put it super tight, just really nice and loose.
Right. Yeah, you don't want it to bind it up. No. They actually make strips for this as well. The urologists have them. So.
That's cool.
So they're saying 3 to 5 erections each night.
Yeah.
Showers or growers?
Okay.
I don't know how you could answer that question, but the size of your penis when flaccid does not necessarily predict the size when erect.
That's right. True.
As small penises are more likely to increase proportionally more in length than longer ones.
Right, of course.
A study from the 80s showed that, on average, longer penises increased by just under 50% from flaccid to erect, while shorter penises increased by almost 90%.
Jeez.
Nice. Yeah, that makes sense. I mean, if you've already got a 14-inch flaccid schlong, it's not going to grow that much when it becomes erect.
You'll run out of blood to your brain. I think we talked about that last week.
Yeah.
Can creams and oils make your penis bigger?
Okay. I'm going to say that's a myth. I know they sell them, and I don't. The only one that I could imagine is if you had Peyronie's disease and they did the injection of the elastase, which breaks up the scar tissue, then that could make it longer. We've covered this before. That there is when Tacey answers this, I'll tell you one way that has been proven that you can improve penis length, or lengthen the penis, but it's not with a cream. What does the thing say, Tace?
No, they can't. The only proven way to increase the size of your penis is by surgery, which can increase length and girth.
True.
What about stretching? Haven't we talked about that with
Yes. Okay. So there was a device that used turnbuckle. So it had a Velcro ring that went under the glands and another Velcro ring that went that attached at the base. And then there was a rod with turnbuckles on it between those two straps, and you could twist that to put more and more stretch on the penis. And the research that I read, they were using this for Peyronie's disease. For mild Peyronie's disease, maybe it helps a little bit. People were getting maybe a quarter of an inch, so it really wasn't worth it. Now, the surgery that Tacey's talking about, it actually doesn't increase the true length of the penis. It increases the apparent length, and that is the suspensor ligament ligation. And what that is there's a ligament that when you were young and you had erections, your erection would point up to the ceiling. That's the suspensor ligament. As you get older, that thing is less powerful. But if you sever it, You can never do that again, but your penis will gain about an inch because it just kind of bloops out of the body at that point. You don't have something pulling it back in. And I believe, Liberace, at least it was claimed that he had that procedure, as they talked about it in that movie with Michael Douglas.
Oh, wow.
Yeah.
I do have one more topic.
Cool.
That was a good one. Now, you said you had shitty topics. We need more penis questions.
I mean, there's literally only so much you can do with a penis.
Well, okay. Well,
and
there's vaginas.
To me,
there's
it gets a little old.
Clitori, there's boobs, there's rectums, there's all kinds of body parts that we could do.
Well, maybe rectums next time.
Okay, we'll do rectum. Oh, nearly killed them.